A very good evening to all. I am Dr. Priya Kapoor, surgical oncologist in Apollo Cancer Center, Chennai. So, October, we see a lot of pink everywhere because this is the Breast Cancer Awareness Month. The theme for the Breast Cancer Awareness Month 2021 is Rally, Rise in Serving, Supporting and Screening Everyone. So, why is this month so important? It is because with 1 in 8 women being diagnosed with breast cancer has become one of the most common cancers affecting women worldwide. In India, the situation is even more grim because 1 in 2 women diagnosed with breast cancer succumb to the disease. And this is not because India does not have treatment options. Right now, India has the most advanced treatment options available. This is because the women present to us in advanced stages most often than not. Also, I would like to tell you that in India, the situation is even more grim because 1 in 2 women diagnosed with breast cancer succumb to the disease. This is not because our country does not have treatment available. India has all the advanced treatment options available, but this is because the women present to us in more advanced stages than the Western population. Also, in India, the age of presentation of breast cancer is a decade younger than the West, which means the most common age group presenting with breast cancer is in the 50s as compared to 60s in the West. So, October is observed as the Breast Cancer Awareness Month as a constant reminder to all of us to be breast aware. It is important that all the women have all the available knowledge regarding breast cancer. It is important that you do monthly breast self checks and yearly screening mammogram with clinical examination of your breast by a trained clinician. Breast self checks are very easy. It is a non-invasive and simple method to be aware of your breast and observe any changes if there are any at the earliest. It is simple. You have to just stand up in front of the mirror, observe any change in the shape of your breast, any change in the size of the breast which is recent, if there is any fullness in any part of the breast, if there is any changes in the skin, if there is any redness of the skin, if there is any discharge from the nipple. Just raise your arms in front of the mirror, observe if there is any swelling in the underarm. There are many videos available to help you through breast self-examination. ApolloCancerCenters.com has a beautiful video available which explains you all the steps of breast self-examination in a very intricate manner. I would advise all of you to go through it once. And from the 40 years of age, all the women are advised to undergo yearly mammogram and examination by a trained clinician. Mammogram is a simple X-ray of the breast which just takes about a few minutes and is readily available. Also, if you have any family history of breast cancer on your mother's side or your father's side, or if you have been exposed to therapeutic radiation in childhood, you may be at a higher risk than the average population. You should meet your doctor to discuss about your risk. About 10% of the breast cancers are familial, which happen due to mutations in the various genes, with BRCA1 and BRCA2 being the most common. These days, genetic counseling and genetic testing is readily available, and people who have strong family history of breast cancer are advised to meet their oncologist to discuss about the same. If you are found to have any defect in the BRCA1 or the BRCA2 gene, there are various options available, including prophylactic surgeries and chemoprevention, which can be discussed with your oncologist. The other risk factors for breast cancer include increasing age, female sex, early menarche, late menopause, not having children, late age at first pregnancy, to say a few. The most common symptoms of breast cancer are a lump in the breast, swelling in the breast, recent change in the shape and size of the breast, any redness or dimpling of the skin over the breast, any nipple discharge, or the nipple going inside in the recent times, swelling in the underarm, etc. It is important for everyone to understand breast cancer is a highly treatable disease, especially when presented early. Stage 1 and 2 have cure rates above 90%. There are various treatment options available right now, which include surgery, chemotherapy, radiotherapy, and hormonal therapy for the treatment of breast cancer. Being diagnosed with breast cancer does not necessarily mean the complete removal of the breasts. If presented early and if you are a suitable candidate, there are very high chance of undergoing something called as breast conservation surgery, where only the malignant lump is removed with a surrounding of normal tissue and the breasts are preserved. Oncoplasty surgery, which is available right now, also helps us to preserve the symmetry and the size and the shape of the breast without hampering the cure rates. The theme for Breast Cancer Awareness Month 2021 also tells us to buddy up with each other because no one should fight cancer alone. So it is a very good opportunity for all of you to spread awareness. You can talk about this disease amongst your family, amongst your friends, buddy up with each other and take the yearly breast checks and mammograms. It's always easier when we are doing it with our friends and loved ones. It also reminds us to check on any breast survivors that we know, because it is all about supporting each other in this journey. In this pink madness, we should not forget that breast cancer is a deadly disease which takes far too many lives every year. Even after celebrating Breast Cancer Awareness Month since past 35 years, the breast cancer incidence is constantly on the rise. It is high time we are aware about this disease and we take part in making our loved ones aware and reminding each other to take monthly breast self-checks and yearly mammograms. It is the time from awareness to action.